Well, for more on World Cancer Day and the battle against the disease, Dr. Omer Awan joins me from Kuwait City. He's a physician and a senior public health contributor for Forbes magazine. Welcome back to the program.
Many thanks. Thanks for having me.
Always. So, cancer is prevalent, it is ubiquitous. Could you start by giving us the state of the disease globally and some of the biggest misconceptions around it?
Well, as you said, cancer is certainly a leading cause of death and disability in the world. We're talking about 20 million people that got diagnosed with cancer just last year, and 10 million died just last year. So certainly a huge disease burden. One of the misconceptions about it is that it's all genetic, or we are all prone to getting cancer, and that's certainly not true when we consider that nearly half of all of these cancers could be entirely preventable by the individual decisions that we make. So many cancers are associated with alcohol intake, tobacco use, and even obesity. So just by uh, paying attention to our diet, exercising regularly, curbing alcohol, avoiding tobacco, this can have a significant effect on us not getting cancer or decreasing our risk for cancer. 40% of cancers are associated with these lifestyle decisions and modifications that I just talked about. So very important public health message for viewers to understand.
Of course, that comes down to personal choice, isn't it? Your lifestyle choices. Is there anything more that can be done to actually prevent this 40%? Now, we're talking about 8 million cases a year, right?
Absolutely. Well, one is just to make sure we get healthy exercise daily, diet, avoiding ultra processed foods, which has certainly been a campaign in the United States, certainly decreasing the amount of alcohol. We just came out of dry January. Alcohol is associated with at least 7 different cancers. Obesity is associated with more than a dozen cancers. That's a big number. And obesity is a threat worldwide. More than 1 billion people worldwide have obesity. Another interesting point that I really want to make here is that progress and innovation is not equal throughout the world. And when we talk about cancer, we often talk about it in the lens of high income countries. But when we look at low and middle income countries, there are stark disparities when we consider innovations that we were talking about earlier, and also just screening rates, which was talked about with prostate cancer. Many countries in sub-Saharan Africa have markedly decreased screening rates when compared to high income countries. And we know early screening allows for early detection, and that saves lives. So very important to advance screening throughout the globe if we really want to make a dent in cancer.
Yes, closing that gap that we see. Doctor, in recent months, we've seen China roll out new technologies, incorporating things like artificial intelligence to help with early detection. What are your impressions of some of these advancements and how they can help us fight the disease?
Well, it's been a game changer when we consider artificial intelligence. Artificial intelligence allows us to diagnose cancers much more accurately and efficiently. Speaking as a diagnostic radiologist myself, that's the field that I practice. Artificial intelligence allows us to detect, for example, breast cancers on mammograms much earlier. It gives us a second set of eyes to see maybe a subtle breast cancer that may be invisible to the naked eye. And the same is true with lung cancers and nodules on chest x-rays. So artificial intelligence has sort of made this partnership with physicians where they're able to work cohesively together and affect patient care in a very positive way. And with cancers, it means detecting cancers earlier, quicker, faster, and allowing treatment to be done earlier and ultimately to save life. So very exciting times for artificial intelligence, and we will see what the future holds for artificial intelligence as we go forward in this fight for cancer.
Dr. Omer Awan, thank you so much for your insight on this very important topic.